Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you to episode 165 of Limb Lengthening Live, where the patients interview the guests. And today we are doing another patient update live stream podcast, where basically we're just going to kind of find out what's happening in the world of limb lengthening with all you amazing lengthening patients out there. So today we have a fan favorite. He is currently getting his limb lengthening done on his femurs. Aaron, welcome back to the show, man.
Good to be back. Thank you.
Absolutely. So the last few weeks you've been here, Aaron, it's been amazing. I mean, you brought some great content last week with your x-ray checkups, and people, if you haven't seen it, go back and watch it. The week before was just like a checkup. And he's been really given like some crazy insights into his femur lengthening process. So as you follow Aaron's journey, you can learn a lot of what to expect with this cosmetic limb lengthening procedure. But today we're going to check in with Aaron, see what's happening. Any new developments, Aaron, in your lengthening journey so far?
Yeah, absolutely. I actually got a lot to talk about what happened after this past week. So, I mean, I gave my update of, my plan, and I posted like in my Discord diary like this past Sunday. But I will say after that post, I mean, things turned south like pretty quickly. Like on Monday, I started noticing like my left shin was getting numb, and I already knew like what that meant. I wanted to believe it was just my imagination. And I was like, all right, it's just a little bit numb, whatever. Tuesday, it was a little bit more apparent. I went into the pool, and then it seemed like it's like my left leg was like being cooled, but I didn't feel burning then until after I came out and I started changing like out of my wet clothes, and then I felt like a little like blip on my ankle, like, and then it just like, and then for 1 or 2 seconds, like the pain was there, but then and then for 1 or 2 minutes, like I felt like an afterburn sensation. I didn't think really too much of it, but I did like 3 turns that day. And then that morning, like on Wednesday when I was about to go to PT, I kind of felt like, hey, if I continue like lengthening, I feel like something bad's it's gonna happen like pretty bad. And lo and behold, I did my turn around around like 8:18 a.m. I went downstairs for like physical therapy, and then like on the way to like the clinic, to the physical therapy building, my left leg just started like burning up like constantly. Like it was super bad. Like I just felt like screaming, and I knew that was like nerve pain. And when I went up, I was like, hey, I got to cancel PT for the rest of the week. Like just move it back. I got to take a break. Please, somebody just get me an ice pack. So luckily I got an ice pack. She told me, hey, just put it up like to like just below the knee, and that will like numb all like everything else beneath it. So man, ice took the burning sensation like very quickly. So I was fortunate for that. I texted Angelique, and we kind of scheduled an emergency appointment with Dr. Robbins, and just to talk about like the nerve pain that I was having. So yeah, I went to see him, and yeah, I mean, he was telling me like, yeah, I mean, you to slow it down for a bit, take up the Gabapentin dosage, and if there's a particular spot that's like hurting you, we can always do some steroid injection shots to kind of numb it. And I was like, that sounds pretty painful. But I told him like, this numbing sensation, like I don't want to risk like, because I know my body is like screaming at me, hey, like you got to stop lengthening. Like I can't take this anymore because like you're stretching your nerves. And I was kind of worried about like any permanent nerve damage. And he was like, Aaron, like I can't guarantee any like, that your nerves won't, permanently like be numb or anything like that. What we can guarantee you is function is, so as long as you can jump, run and do all that sort of stuff, that's what we define as success. But I've heard stories of people here, like their numbness hasn't gone away for like 2 or 3 years. And that was something that I was really scared about and that I didn't want happening to me. But that's just something I just kind of like have to like mentally accept. Hey, it's just part of the process. So yeah, I mean, yesterday I would say like that was the worst day out of like my entire limb lengthening journey. Like forget the first 2 weeks. I would just say like that burning sensation that I felt throughout like the day, it was just super bad. But so I went back to my hotel, and I just prepped my polar care, and I was just pretty much icing my shins like most of the time. And that was just pretty much pain control was my main focus this past yesterday. And I talked to a lot of people on the Discord. I talked to people who have had nerve pain before, and fortunately they said, hey, you know what? Taking a break, slowing down really does help, and I think about Natalie. I rewatched the episode where Natalie talked about her nerve pain, and I just felt like if she could do it, then then I can do it too. So I did 1 turn yesterday. Today and tomorrow I'm planning on just not lengthening at all, and I'll just start doing 1 turn on Saturday, 2 turns on Sunday, and then resuming back to 3 turns on the weekdays, and we'll see how things go. Just taking things slow. But yeah, that's where I'm at right now.
Wow, wow, wow. That is a lot of a huge development and a lot to unpack there. Let's just start from the top. So first of all, this all happened yesterday, like kind of all of a sudden.
Yeah, in terms of pain and the burning sensation, like I would say this definitely happened like yesterday morning. Like
Wow, that's crazy. And it's so crazy because what length are you at right now?
I'm exactly at 4.7 centimeters.
Man, it's something about femur patients crossing that 4.5 centimeter threshold, close to 5, that all the nerve pain seems to happen. And don't get me wrong, it can happen before or after that. But I've talked to a lot of patients, and the nerve pain, if they do get it, it seems to happen between 3 and 5 centimeters. So, and is it only on one side?
It is actually on only one side. It's on my left shin.
Hmm.
Yeah, nothing on my right so far. So that's good.
Yeah, that's really good. And it trickles all the way down from to the shin. It's not up in the
Yeah,
femur.
yeah. It's up. It's up.
Okay.
Nothing in the femur. It's just like below the knee on my side, like just below the knee, all the way down to my ankles on my
Okay,
right
so it does
side.
run
Yeah.
down. Wow. Okay, and so yeah, so 4.7 centimeters in, and you don't want to stop. Now, it's true that I've heard a lot of surgeons over the years, and they say that basically, as long as you have motor function of the nerves, you'll be fine. But nerve numbness, it can stick around. I had nerve numbness in my tibia when I was lengthening it for I think up to 2.5, 3 years after. It eventually did come back. But that was really cool that you said that you have to kind of come to terms with that, because it's something that we are kind of going against the grain here of, like, biology. We're kind of cheating the system about lengthening our legs. And you're right, the nerves are like the big crybaby in the room that they don't like to play nice. They'll wake up and they start screaming. But the good thing is that you did up the dose of gabapentin, and then you said that the icing did help with the pain.
Yeah, so I took I was at 3 dosage since like I would say 2 to 3 days ago. I'm planning on upping it to four and then eventually like five if need be. I don't think I'll hit that six mark, but we'll see. But I will say today it definitely feels better. I mean, I ever besides this morning where I just felt just a little bit, I don't think I have any like flare ups since this afternoon. So I would say upping GABA, just stop lengthening overall is I think that definitely did the trick.
Yeah, absolutely. Because what was your rate of lengthening that you were going at?
And it's funny you mentioned that because like it was four turns up until the last weekend. Last weekend is when I started doing just two turns, and then on the weekday I still started doing three turns. But I feel like, but the numbness really kind of started around like the weekend ish, like a little bit on the weekend and then the weekday. So I feel like my body was kind of paying for it
Mm.
based on all like keep doing like four turns like on the past weeks. So I don't know. Maybe I would tell myself like the moment I started feeling like numbness, I would just take a break completely for like 1 or 2 days. I don't know if I would have waited up until yesterday where I actually started like feeling a serious burn in order for me to completely stop.
Yeah.
But yeah, but I'm just being conservative with my terms right now. And obviously like I adjusted my new plan, so it'll take me maybe like a week later to reach my goal. But we'll see. I mean, who knows if I'll have another episode of like serious nerve pain. I have to take a break as well. So
That's really cool that you say that, because I talked to, I think it was some PMAX patients when they did release last year, and then it got pulled off again. And they were having nerve pain as well. And what they did is that staggered lengthening approach, which you brought that nice chart last week, which people can go back and check out. But you updating that is just showing that you're listening to your body and you're paying attention to what happens as you lengthen and observe. However, I do know that the staggered lengthening approach does help, because those nerves, they do not like to play nice with the lengthening process. The muscles are okay. If you do your physical therapy, you'll get through. The bone, it's fine. But the nerves, those are like the baby in the room. Like I said, you wake it starts crying, and you just can't get to go back to sleep. So it's in your left side. You said left leg?
yeah, my left leg.
Gotcha. And nothing in the right.
Nothing on the right.
That's crazy. Okay. And you're taking gabapentin, some icing and stuff like that. So the flare up is kind of like under control. You're just monitoring it. And your goal again, Aaron, what was it?
I would say it's around 7 centimeters, but you know what? I don't know if my goal would change. You know, I never thought about quitting so much until yesterday. Like if I felt, I know I was kind of like in the moment. I know it was a little bit temporary, but like like I said, I just felt my body screaming. At that point, I didn't know if I had to come to terms with like permanently risking my nerve damage just for an extra inch.
Yeah.
But like I said, that's just something I kind of eventually just came to terms with. Now today I feel a lot better. But
Yeah. Yeah.
yeah.
It's hard to kind of describe it, because I want to ask you this, because I know Natalie said it when she came on the several shows, is that the nerve pain was way worse than any of the pain that patients have early on in the right after surgery pain. Would you agree?
I would say so. Like I said, like yesterday, I definitely can clearly say that was the worst day compared to like even the first like 1 or 2 weeks,
Wow.
right? In my
That's
opinion. Now,
mhm.
some people might say, I know someone who another patient here, and she said like, I mean, she's had like nerve damage or injury before, but to her, she still felt like the surgery phase was a little bit worse. So I feel like for a lot of people, it's going to be different. But
Yeah.
for me, I would just say the nerve injury, well, the nerve pain is definitely pretty intense.
That's crazy, man. That I can only imagine what you're feeling right now. But like, it's cool that you're listening to your body, and I think a lot of patients need to kind of hear this because of the fact that it's something that you can't really predict. Because were you doing anything in particular? You just say some of your lengthening rate and like how much you were lengthening and the amount of length that you achieved probably did lead to this. But do you think any physical therapy stretches or any type of movements exacerbated this?
I don't think so at all. I think like with nerves, it's like I feel like muscles and nerves are two different things because like muscles is pretty easy to stretch, but like nerve, it's like it will just grow on its own, right?
Mhm.
There's not really much you can do about it. The only thing you can do is just a very good solution is just stop and allow it to catch up. Besides taking gabapentin, besides icing it whenever it does flare up, I don't think any physical therapy movements or any particular position really, you know, instigated that at all.
Gotcha, gotcha. Because I know in Natalie's case, she did remember that she was doing some physical therapy a little bit aggressively, a little soon, and then it did exacerbate it. But like, different people, different
Yeah,
situations.
like in her case, I remember she described like if they were stretching her like her left hamstring or whatever whatnot, then she'll feel in her right. Yeah, I did feel that like around 1 centimeter, but that was like a nerve stretch. That was like on my thighs where I felt just a little bit burning, and then when they got me back in the neutral position, then it just disappeared. So
Mm,
that's a nerve stretch. But nerve pain is like shins go numb. A few
yeah,
days later, then you start feeling like really bad burning on your entire like lower leg. I mean that's really the nerve pain that everyone was talking about here.
yeah. I had it one time before on my tibia. It is just temporary. It was like a day experience, and it was terrible. And several other patients, femur patients in particular, because it does go downstream and it goes below knee BK. And I tell you, it's pretty rough and it hurts. But I'm glad you're kind of over that obstacle. Hopefully, it doesn't happen again, and you can kind of keep it quelled. But we'll see what happens, man. That's huge. Thanks so much for sharing that. But all right. So was that the major development of the week since last week?
I think so. I mean, it's only been 1 week
I
so
know.
far, so yeah, that's pretty much my main highlight. It's just the nerve, learning how to deal with the nerve pain, and just completely taking a break. I really hope that I know because my bone growth was so good. I really hope that not breaking for about 2 to 3 days is not going to have me at risk of pre-consolidation. But I talked to
What?
Dr. Robbins about this, and he was like, "Yeah, it's a 1 in 10 year chance, like in his case, but that is just one of those things that you're just going to have to kind of accept that it is a potential risk. So we'll see."
Yeah, because you had some amazing bone growth, and I know that in younger patients, but also patients just who heal really fast. I was talking to a guy in a consultation yesterday, and he's healing extremely well, and his surgeon wants to keep him at a little over 1 millimeter because he's healing like a 20-year-old. And so, do you feel that? Does Dr. Robbins feel that your bone is going to heal a little too fast if you stop for too long, or he's just saying,
I don't think so. He didn't really mention anything
okay,
about that. But I mean, like in the beginning, he just gave me some warning signs. Like if you put the machine and you start noticing it has like the sound it's supposed to make. If you hear anything different and you hear that like twice in a row, then it's probably a sign of pre-consolidation that you need to get X-rays like immediately, like the day after. They'll try to diagnose it.
Gotcha. Yeah. Because I remember one time I was had him on a podcast, and he said it does take a couple weeks, but like it's all about how fast the patient's healing. So
Yep.
you have like that Wolverine level of healing, so it's pretty cool. Awesome, man. Well, thanks so much for that update. Look, what we're gonna do now, we're gonna go into the live chat. There's some people who have some questions in here. Let's see, Ben Mendoza, what's up? How you doing? Yeah, Aaron Ben. Um, so Aaron, this one's from Choice Designs. He's saying, Aaron, do you take any ALA, alpha lipoic acid supplements for your nerves?
No, I haven't heard of that. I can definitely take a look into that. I know someone recommended to me like vitamin B supplements, so I am taking that. But other than that, no. I'm also taking magnesium glycinate. I heard it also
Mhm.
helps with like your nerves and your bones. So I take like one before I sleep, and I also take one during the day as well. So that's all I take right now for my nerves.
Gotcha. Yeah. I mean, really, like I think that there's more direct approaches you can take, like you said, slowing down lengthening and taking gabapentin and icing and stuff like that. But this stuff can definitely, supplements may have direct effects, and who knows? If you find something out, let us know. Victor, are you on Ozempic? No, I'm not. You're talking about my weight loss? No, I'm a natural dieter. I just do it through diet and cardio. Master Distractor, my man, how are you?
I'm good. How are you? Just getting my steps in while I do this stream. I don't think I ever joined this stream and never multitask. So
that's the way to do it, brother. So since you were on last week, any new developments with you?
I'm at 65.50 distraction. I'm at going 0.75 and 0.5 alternating. I still have no pain, no tightness. Reduced physio to 1 times a week. And yesterday I had physio and we didn't even work on my legs. We had some back pain, random. We just worked on that. And yeah, I just need to get more steps in. Need to stand more. Dr. Gedelit said to improve my bone growth to just stimulate it. So bone growth is not ideal, but we're going slow and trying to sleep, eat, stand, walk. So that's what I'm trying to do right now.
And you're going at like 0.75 per day, right? Millimeter.
0.75 and 0.5 alternating. So 0.75 one day and 0.75. So
gotcha.
I think we'll do that till the end. So we're almost there now, right? So 65. We're almost there. So yeah, we might accordion.
You're going for,
but I don't know.
How much length are you going for? 65 or no 80?
82.
yeah, because it was like on the 18th or something of the 20th. No, when are you going to be done? You said like you'll be done on the 20. In 20
like
days, 20 millimeters. That's what it was. Okay, yeah, I gotcha.
Yeah, something like that. Yeah.
Okay. Is she concerned of like is your bone showing up in the regenerate gap? Like, is it all, or is it just like really faint?
So the thing is, I don't look at my X-rays because I can't see very well. I have eyesight problems, so I don't know. I just do what she tells me. Yeah. But I need to get. I'll just get a. Can you hear me still?
Yeah.
Yeah.
Yeah, we can hear you.
Yeah, we can hear you.
Okay, great. I'm just walking up. So I don't know how to look at my X-rays properly. She has it on the computer, and when I try to squint, I can't see. But I can get like photo of the X-rays if people really want to know. But so far, she said it's there. It's getting like it's there, but it's not ideal. So we're just going slow and trying to increase steps and stuff like this.
Gotcha.
Trying to stimulate it.
You need to borrow some of Aaron's bone healing ability. He's
yeah.
Honestly, I would trade a little bit of that. I don't want any like pre-consolidation, especially now that I'm kind of like stopping lengthening for like 2 days right now.
yeah, that's weird. So real quick, MD. So have you had any nerve pain? I think last week you said you haven't, right?
I have absolutely no pain. So soft tissues have no issues. Like I have no soft tissue issues at all in any setting. So yeah, like there's no pain at all. I'm not on Tylenol, nothing. Like literally, I feel nothing. And then I'm just walking, like trying to do my steps as much as I can. But I think I'm just lazy, so try to do as much as I can. But no, soft tissues, no issues. Just the not the optimal bone growth right now.
Gotcha. Yeah. No, that's awesome, man. I got to give you like credit because you're at 60. Well, I can't see your
65.5.
65.5, man. That's crazy. A lot of people want to get to that amount for the conservative amount of length and then call it a day. But that's incredible. Very cool. All right. So let's see. This one from DJ for Aaron. I think, how old are you? Also, what's your body weight? And did you do any pre-op stretching exercises?
Yeah, I'm 24. Body weight was like 145 pre-op. As far as pre-op stretching exercises, I didn't do a whole lot like heavily. I did, I sometimes like when I was like standing up, I would bring like my foot like to my butt and I would hold it for like a few seconds, just like to get my knee bend and just kind of flex my quads. But I didn't really do that kind of like actively. It was just like every once in a while thing. So. I wouldn't say I was I wouldn't consider myself a heavy stretcher pre-op, unfortunately. Yeah. But I mean, so far I'm doing well. Like, I mean, my therapist has been saying like your range of motion is great. I mean, you're able to get a 140 like pretty well. So that's not really an issue right now. It's just my freaking nerves.
Yeah. Wow. 140. That's usually 135 is like average for people who aren't even doing lengthening. And you're at you're 140. Jeez.
Yeah, I mean it's not easy, but I can still like get it there. You know, if the therapist just slowly like pushes me towards there, then I can get there pretty well.
Yeah, absolutely. I want to actually ask you a little bit about like what you notice now that you're pretty much at that 5 centimeter mark, Aaron. Do you notice that like any type of weakness in your legs, or do you feel like it's all been pretty much straightforward and the same since you approached like the first centimeter or two?
So there was definitely weakness when I was on my glutes and my abductors. Like when they get me on my side and they ask me to like kick my right or my left leg like up in the air. Oh, there was definitely weakness. Like on like week 3, I couldn't even do that unless like someone was like assisting me with that. But I think that muscle strength did definitely, come back up. As far as like tightness, I think the only things I really feel I definitely felt my quads being tight around 3 or 4 centimeters, but so far I haven't really felt any particular like increase in tightness since then. So
Gotcha.
yeah.
That's crazy. That's awesome. And what about you, MD? Like, do you notice that like your legs just get weaker as it goes on, or does it kind of level off and you feel like the same?
I think they were weak, right? Like ever since surgery, because you get Botox, right? So the Botox causes some weakness, and I think it's still weak because I can't really do like a leg raise too easily. But I think that's it's probably a combination of Botox and my muscles weren't ever huge to begin with. But in terms of, I think they like bulked up back a bit because I stopped for a while and they bulked up back a bit.
Mm-hmm.
But I mean, it's not like weakness that I like can't do walking. Like it's just like if I'm trying to like do like a lift, like with leg extension, I can do it, but it's not easy.
I gotcha.
So in terms of like going back to range of motion, I don't know. I can show you on my channel, but it's not monetized yet, so it just goes back to Discord, the links, but it has all my videos in the range of motion if you want to see.
Wait, MD, I saw that video. You were like pulling your foot back, like the pro knee bend stretch, and dude, like I tried doing that on my own, like with my hand, and I think you made it look pretty easy compared to what I went through. I was like, I don't think I can even do that.
Yeah, it's still the same. Like I have I can get it like almost, I think 90 degree on the hamstring on one leg, and the other one if I try hard, I can also get 90 degree. And everything like for prone quad stretch, I can I can't get to my butt yet, but before I used to, but I can do it with my hand. Like I don't even need the strap. Same degree right now. So that was, I think I filmed that. I think I don't know, 4 or 5 centimeters.
I think it was around 5 centimeters. Yeah, that was pretty impressive.
Wow.
But it's still the same. So, but you can see it if you want. It's all on my channel.
YouTube channel. Yeah. I got to find that link. I have it and I'm subscribed to it, but we'll definitely check that out. I got to say that, for that type of flexibility this deep in, it's looking pretty good for you. I think the bone growth is the only thing that you are you considering doing bone stimulator or using bone stimulator or anything?
I'll just do whatever Dr. Goodell says. So
gotcha.
she's like adamant on me standing forever, never sitting down, and getting as much steps in up to 4,000 steps. But I mean, I'm not. I don't know. I kind of lost my motivation for a bit because I got stopped, and that like crashed me. And now I'm trying to regain my motivation and just walk more. Yeah. But I'm having. I can do the 4,000 if I like get myself motivated. It's like it's not a physical issue that I can't get it. It's just me getting my ass off the apartment and just walking. So so honestly, like when I talk like this, like sometimes like I talk to like some patients and stuff this week because they reach out or whatever. Because when I go for a walk and I start talking to people, I'm more motivated. Even this, live stream, it's just basically a phone call, right? So I'm just like more motivated to just, walk around more. So that's literally like sometimes it's boring to just, walk around in circles in my apartment building, right? Sometimes I do.
I think we might have lost him for a second.
Yeah, I think he cut out.
Yeah, cut out. MD might be in a bad spot there, but no, man, I agree with you. I think that the motivation's everything, right? Especially at this point where you're like trying to fight off, poor bone healing, but you're also trying to get to your goal. It's kind of like me and my cardio for my contest diet. Some days it's like 90 degrees out there with tropical rainforest humidity, and I don't want to run, but the motivation, you got to dig deep. But that's amazing, man. I really like that you're getting up and doing what you got to do. He'll join back again in a second. But anybody else have any questions here for Aaron or MD on the stream? Thanks, Froggy Dragon. All right, he's back. Let me get him on.
Yeah, I think the connection got lost.
Yeah, it kind of dropped out for a second there. So yeah, man, it seems like you're kind of killing it there. You're doing really well. Keep doing what Dr. G says. She's going to steer you right. Yeah, and Aaron, we got somebody else joined. Let's see here. Bobby Jones.
Hey, what's up?
These surgeons have done more femur surgery. Tibia, 2 bones, very, very risky for axial deviations, nerve issues, and whatnot. So I love your update, Bobby Jones. So that's great, man. We'll have to have you come back on for some other stuff. What real quick, one question is, so when you're using these night splints, are you wearing them at night? Because I know for a fact that it did help with the swelling, the compression of it. But are you wearing them as you sleep overnight?
Yeah, I'm wearing them overnight, and I loosen them up a little bit. Because if they're too tight, man, it's impossible to sleep. Gotcha. But they're not too loose, but definitely they kind of. And there is the upper one. What is that? Like a belt. There are 3 belts at the ankle, and the higher one. I opened the higher one because the higher one is the area where I had the breakage done. And it's.
Oh, deal, man. I love it. That's a great update. All right, real quick before we kind of close out, because I don't think we have too many people on today's. Let's see. There's a few questions in here. Davidson is asking, any news on the PMAX nails? I haven't heard anything. It's been quiet. So we'll see what happens. This next one from DJ, not DJ Cyborg, so another DJ. Are Dr. Gudalovic patients having pain due to something? Also trying to solve the puzzle. Why did the doc not talk about the nail bending issues, but Dr. D patients do it without? Okay, so I guess this was going back to you, Bobby Jones, about standing, or maybe it's Master Distractor. I don't know who DJ was referring to here. Oh, we got Socrates on the show. What's up, Socrates?
I mean, maybe MD can reply. Just say she tells everyone to walk. Just you keep your weight on the crutches or walker.
Yeah.
I have pretty strong arms, strong for my weight. Let's say like this. I'm not a strong man, but it's pretty strong, I think, for my weight. So honestly, I don't have any problems with that, walking.
Yeah, I think it's fine. You just offload your weight enough. They're not full weight bearing nails, so as long as you offload, you're fine. Okay, so then let's see this other question here. Then we'll talk to Socrates for a sec. What happens if the bone doesn't heal after 3 to 4 weeks of consolidation? What do doctors do? Well, usually they just wait. Then they just wait a good amount of time. You may be a slow healer, and that's sometimes a delayed consolidation or delayed union. It can take time. A lot of patients aren't super fast healers like Aaron here. He's blessed with Wolverine genetics. So, and as was Socrates, and a lot of patients are. Not everybody is. So you just kind of have to monitor it. But they usually don't panic until it gets well beyond below average, which is let's say a year and you still haven't consolidated. Then they may intervene and say, hey, let's do a nail swap. Hey, let's do a bone graft. Hey, let's do this, that, and the other. They have backup plans and contingency plans, but really 3 to 4 weeks isn't much time. So it's not going to heal fully in that time. Some people do, but all right. Let's see.
Victor, can you hear me?
Oh yeah, I can hear you. What's up?
Okay, here. There's 3 questions you asked, and I can answer 3 of them. In terms of the fasciotomy of the tibialis anterior,
yeah.
As far as I know from your 3rd interview with Dr. Gudalovic, that was in 2023. She was doing it. So I'm assuming she did it, unless she changed her mind. In terms of Botox, I'm pretty sure she does that too. Bobby Jones, I think you can check your invoice to see if it's in the Botox. Your invoice, I'm pretty sure it did.
Oh yeah, that's a good idea actually.
That's a good idea.
I'm quite certain she does both of those. She does fasciotomy of the tibialis anterior as far as I'm for the compartment syndrome. I'm pretty sure she does Botox, but I can double check with her.
Then that makes sense. Let me tell Bobby Jones something, because I didn't know if she did it, and I assumed that she didn't. So I had a fasciotomy of my tibialis anterior, and you probably did too. And that hurts like heck, that front anterior portion. So when you're walking and you say, oh, where they broke the bone, it's actually, yeah, the bone break does hurt a little bit, but it's actually the fasciotomy that hurts more. So
yeah, I think I just double checked though, because that was like 2023, but I haven't asked her personally, but I know from her interview she said this. And
check
I'm
on that,
quite
because
certain.
Okay, so I see Botox here. It says general equipment supplies Botox, so it's there.
Yeah, Botox is there, for sure.
Okay,
for
so
sure.
Botox.
She
But you
always
don't see
uses Botox.
fasciotomy?
Osteotomy, where is that? Admission.
I don't think it's there. She doesn't include the actual surgical steps in that voice. In that invoice, she doesn't. But you agree to it when you go to what. I'm gonna ask her next time.
Yeah, you see, fun stuff about me is like some patients, they know this stuff like Botox, osteotomy. I don't ask those questions my surgeon. For me, it's like more result, and I just trust my surgeon. So sometimes I just I don't know what she did, like exactly.
Well, next time you go for a checkup, ask for our own sake.
Sorry, and Victor, one more question I can answer. For the 85, like for standing, I am literally right now just standing, and I am putting full weight without I'm not offloading, and we're going 85 pounds per leg because I'm 100 like right now 150, a bit under 150. So we're not going by the 50 pounds per leg. We're going 85, and we've been doing that. Like all of us are doing that.
Yeah, but you have the 12.5 millimeter nails, right?
No, I'm 10.7. I'm 10.7.
10.7 should be 85 per nail. Wow. I've heard some rumors, and I'm not going to say anything because I don't want patients to hurt themselves with their nails. But just at the same time, it's like if your surgeon allows you to do that, listen to your surgeon. But at the same time, it's like I guess I
think it depends on the surgeon, like who you're going to, right?
Who you're going to, and how they feel.
For us, our physio, like we do what we're told, and like this is I can stand. Like I asked 100 times. That's my main. Like I think the paranoia of everyone here is how are we gonna break the nail, right? Like that because they're very very expensive nails. But I asked like 100 times physio, Dr. G, and I have been like I am literally right like all the time. I am just standing, no offloading.
Wow, that's pretty crazy, man. I gotta give you
with the nails too. Something I want to add is please listen to your surgeon and do what your surgeon says. But from what I know is like think of it like when the nail is loaded on its vertical axis, that's when it's really strong. And then when it's loaded on its horizontal axis, that's when it's more likely to bend and be weak. So what I did was just like anytime I'm going from standing to sitting or sitting to standing, I would offload a lot. Like I would say like 80-90% of my weight even on the walker. And then when standing, as long as both feet are on the ground and weight is distributed evenly, you can stand if you're under like 170 pounds.
Cool. Yeah. And it also depends on how far it's distracted and the stress. And there's a whole lot of factors go into it. No, absolutely. That's great. Like transitioning from standing to sitting, lateral loading, like he said, you got to be careful with that because the nail isn't tested per se in those positions. Vertical loading is a lot better. That's why tibia lengthening for you, Bobby Jones, is good because it's a very vertical bone. So you're always going to have a vertical bone. Femur changes direction depending on if you're standing or sitting. So you got to be careful.
So what I heard from the team, they said that they had cases when femur nail was broken, but they never had with tibia.
No, it's a vertical bone and it's much safer, but you still be careful.
Don't play soccer.
Sorry, with the femur bones that broke, I know there's 3 cases with us, or not, sorry, but like in Canada, with this place, and I think they're all rotational movements or very, very heavy loading, doing very messed up things. It was not from walking or standing, but
real deal. Right, exactly. Real Deal said he had one, but it was because a bookshelf fell on him and he had to catch it with one leg or something.
Like I'm not doing shit. No one's doing stuff like this. That's never recommended.
Bookshelf. Oh my god. Oh man, Socrates, what's going on, my man? think he was on here for a second.
Some technical difficulties, but
okay, we can hear you.
I'm here, and I walk in and I hear Rial had a bookshelf fall on him.
Yeah.
What did I miss?
I thought it was a pipe fitting or something. Like he was changing a pipe.
He was doing everything under the sun.
Man,
Man.
he was climbing stairs like 3 days after surgery. He's a special breed.
He definitely was.
He's a champion.
We're talking
hope he's doing all right.
Wolverine. He was Wolverine and reincarnated. Oh man. Okay.
Yeah, exactly.
This question to you, MD, from DJ. What size is your nail? What's your weight? And any other Dr. G patients have any bending issues?
I am on the 10-7 precise 2.2 nail stroke enteric. My weight surgery with fasting was 137 pounds. I have ballooned up to 152 pounds since surgeries in April. And what was the other question? Weight, nail?
You actually answered that earlier about you said how many cases about so real quick about your weight. So do you think it went up that high because you're eating more calories, or like do you feel like it's just lack of activity? Which one do you think it's?
I think because I drink too much chocolate milk. Because I know it's hard to get all the food I need to get, so I'm addicted to chocolate milk now. So I think lack of activity too. But I mean, I try my best to walk, but it's not like I'm running. Like
wait, Master Distractor. You mentioned before, like prior to doing femurs, you lost 50 pounds in 3 months or something like that.
Yeah, I did something insane, but I wasn't like right before surgery. It was like last summer. I lost 50 pounds in 4 months. But because I ran like an insane person and I calorie restricted to my really, but I stopped doing that until like last December, and then I stayed normal. So it wasn't like I came to surgery like a very horrible nutrient state.
Gotcha.
But it was still like that's a bit too much. I would not recommend doing that for anyone. I was just like a bit concerned, like or like I was the same concern, like we were like always like, oh, am I too heavy for the nail, blah blah blah. So I don't think it's a good way to do it. I think maybe now hurting myself now because maybe I don't have enough mass, and that may be like causing problems with my bone growth. Because I'm very like if you see me in the videos and stuff, I'm quite like I did that on purpose. So I tried to get down to the least amount I can to be as lean and cardio. I wanted to be very stretchy, had the very lean body, so I can stretch as much as I can in terms when it comes to distraction. But now it may be working against me.
Maybe. I mean, you're not, too like 100 pounds, so yeah, it could be that.
Yeah, but I didn't go to surgery like in that state. I did lose a whole bunch of weight really fast, but then since December I just was on maintenance mode. And yeah,
that's great. Real quick, MD, he's asking a follow-up. Hold on, I'm sorry, I just put my phone on silent and it's still coming through. That doesn't make sense. I don't know how. Oh, it's because it's a Mac. Let me just end that call. Yeah, MD, so he's asking, using medium-sized nail and your age, if you're comfortable sharing.
Oh, age, yeah, mid-30s.
Okay, and then you already talked about the nail. Okay, so there you go, DJ. And then MF is asking, does nail weight-bearing allowance change during consolidation phase? This is a good question. Let DJ Cyborg answer this one.
Yeah, so pretty much as more and more bone fills in and more bone ossifies, it helps protect the nail more and more, and you'll be cleared to weight bear more and more. And it's just like what your surgeon says. Like they'll start you off with telling you like, okay, now you're okay to walk with your body weight only, and then eventually they'll tell you like it's okay to go upstairs, go downstairs, and then it's maybe a few more months later you can start doing light jogging, but extreme jumping yet, and then you just graduate more and more until you're just cleared for every single thing.
Yep, it's a graduated progression. I remember that too. It was like 25%, 50%, 75%. Although I kind of jumped from 25 to 75 because I was being impatient. But yeah, that's exactly what it is. Very cool. Socrates, was that the same for you? Like a graduated progression of weight bearing? Because you were walking within 4.5 months. You still have one of the top records in the game right now.
Yeah, I credit that to a lot of stretching, physical therapy every single day, and hydrotherapy. And I never used a wheelchair. I used a rollator from day one. And I'm a big boy. I weighed 185 pounds to start with. So even with the 12 millimeter nails, I was definitely not cleared to weight bear anything. So I had to offset my weight on the the rollator the whole time. And surgery was in December. Lengthening ended in the middle of April. So it was 4 months of lengthening. And then I was cleared to walk about a month after lengthening because I hadn't lost a ton of muscle.
Wow.
That's what I think. And then August, so May I was cleared to walk. August I was cleared to run. I had my rods in, right? I was running, 5Ks, 10Ks. I ran my first mile in September with my rods in, and then I got my rods. I was lazy in the beginning of 2020 of this year. So about a year after surgery, I ran a 10K, and then for the next 2 months, I got busy at work and was doing other stuff. And then I got my rods removed right at the beginning of April, and that's a huge relief, but it's a huge setback because your muscles and your bones and everything are not used to the full weight because the rod bears 75 pounds or so per leg, right? So I was not cleared to run for 6 weeks. So that whole time I was just in the gym, stretching, lifting, trying to get the muscle back to the same strength it was. And that's going to take some time. And now I'm at, 3 months after rod removal, and I can run 4 miles in an hour. So I have a marathon in 2 months, and I have no idea how I'm going to get ready for it, but I'm going to do it or die trying.
I love it, man. I can't wait to see you do that. That's crazy. I love your progression. I really do. And I think that you mentioned something there that not a lot of people pay attention to. It's like when you get the nails removed, there's another recovery phase. It's shorter than when you do lengthening and you're consolidating, but it's still there. And I think it's, like you said, 4 to 6 weeks. Some people it's longer, some people it's a little shorter, but I think that you have to be prepared for that. Are you able to walk right after rod removal? Yes, but can you do everything you did up to the point before rod removal? No, that's going to take some time. And I think that you are 100% right by keeping your muscles strong and being patient and doing closed chain movements when your foot is in contact with the ground, like squats, leg press, things like that. You're fine. But you start doing running, you got to be careful because they removed a lot of those screws, which can create they're little microfracture points where they can cause, I think Dr. Robbins calls it stress risers, where like if you hit the ground really hard, you can get like a little fissure that can lead to a stress fracture. You got to be careful, big time. So that's huge. Wow, Socrates, man, 2 months. So that's right, October. Is he still with us? Oh, he's muted. There you go. Can you hear us? So it's in October is your marathon? You might have stepped away. All right. Well,
hey, Victor.
Yeah.
I wanted also to add, I forgot to tell you, that's also for people who plan to do tibia. So another headache was with tibia that didn't happen with femurs because the area, the front of the leg is so tight, where the scars are. On the left leg, I had 2 incisions. They've been kind of open 2 weeks after they removed stitches.
Yeah.
And one was keep leaking slowly. It wasn't blood, but just like water, like watery stuff, and maybe that swelling, like up to 1 month. It was gone only like maybe 6 days ago. And that was super annoying, especially in the first week or 2 when I wanted to go on the slant board, when you stand on it and there is lots of pressure, on your front leg. And it keeps leaking. It's not fast leaking. It's not the bleeding, but it keeps like leaking, and that's annoying because I had to use my own chlorhexidine to clean it, and you're a little bit worried about it. What if there is an infection or stuff? So that's another headache with the tibia because the area is super tight at front, and the swelling goes very slowly away. And when I did Doppler a week ago, that woman said after she completed, she was like, "Yeah, all good, all good. You don't have any blood clot." But honestly, I thought on the right leg, you see that there is bigger. I thought it might be there. I was like,
Yeah.
"Oh, thank you," because of the swelling.
Yeah, it sounds like some edema, like some fluid buildup in there, and I definitely recommend using the compression of either your night splint or some sort of compression sleeve, or
It's almost gone. I think I
It's
didn't
almost
have
gone?
any. Yeah,
Oh.
night split boots. They helped me actually with the
They do.
compression.
I
Yeah.
figured that out within a few weeks of using my like molded cast. I'm telling you, people are sleeping on that. If you get the compression's everything, and you can get different compression sleeves and stuff, but that helps tremendously with the swelling. And you said it's almost gone, right?
Yeah, I think it's gone. It's like it's basically 95% gone. Like,
Cool.
I don't see it's like feet, ankle. It's basically gone.
Yeah, and
Bobby?
the tibia, real quick, the tibia is very prone to swelling because it's BK, it's below the knee, right? Like a lot of the femur, it will swell up in the first few weeks because it's just you broke your leg, but the tibia can swell up for a longer period of time during lengthening because it's well down there, it's way down there, and gravity goes down. So
I'm happy it took a month for me because I've been checking some stuff online. It says up to 3 months with some people.
Mhm.
So, and because it's hot, I have AC, but the first week it didn't work. It was so hot. I didn't wear those compression socks, only bandages because my doctor allowed me. But bandages, they didn't help that much. I had to use ice several times a day, and you just lie in the couch. And you know how much time you lose. I'm like, damn, I need to do some stuff, like, let's say for work, and then I need to work, and I'm just sitting there, like, lying down with ice. It's just, that's what I'm saying, it's different. With femurs, I was kind of like so fast, ready for the action. With tibia, it was almost about 1 month before I came back to action I could do with femurs.
Yeah. MD, did you have a question for him?
Yeah, Bobby, how far along are you in terms of distraction?
Yeah, I was just saying before, 1.5 centimeters.
1.5, okay, thanks.
Yeah, that's crazy. And he's going for 5.5 as a minimum, and he's shooting for 6 or 7. So we'll see what happens with that. So very cool. All right. Anybody else have any questions for the panelists, these limb lengthening patients? We got Aaron, young Wolverine over here. We got DJ Cyborg, who's past femur patient. Socrates, the wise one, is on here. Bobby Jones, the new tibia lengthening patient. So we'll call it going once. We'll let you guys put your questions in the chat if you have them.
Question for Bobby, actually.
Yeah.
So I mean, you said you did femurs, right? You did the full 8 centimeters.
Yeah.
What was okay, perfect. Yeah. What was your experience with nerve pain? I think you mentioned once of that because currently I'm in the trenches right now with nerve pain. So I just wanted to hear your experience of it.
So I had this pain, that discomfort when I was at 1.5 centimeter, and it lasted up to 4.5. I remember when it started. I'm not sure if it's related, like connected, but I was at the massage table with my physio, and I was like, "Hey, look, I can still touch my knees with my head, just like." And at that time when I did that stretch, I felt like your legs stretched kind of like too much. And after that, slowly, same day, next day, I started feeling something like, what is that, dragging, your ankle, then upper leg. And it was for 1 month, and then it was just gone away. At the daytime, it didn't disturb me much, but at night I couldn't sleep, so I had to use hydromorphone every second, third night. I didn't want to use it often, but it was just disturbing my sleep. It's same like the split boots, just like tight. I just couldn't concentrate on the sleeping. And I told my surgeon, and she was just like, "Oh, it's too early." And basically, they didn't do anything about that. I had just to deal with that and use hydromorphone, and then it was gone.
Was there any numbness that you felt in the?
Honestly, no numbness, but I don't know if it's like really nerve. I think it's nerve. It was dragging in my ankle, and then it goes to my butt. like through all leg. And it wasn't that bad because I think I have pretty high pain tolerance, honestly. But at night, I just couldn't sleep with that. It just disturbing you. You can't relax.
Gotcha. And yeah, I heard it from Socrates about how he managed to resolve his nerve pain with the accordion method. But that's not an option for me because like it's I have pretty good bone healing, so I don't know. I don't want to run into a risk of pre-consolidation for Dr. Robbins. So just taking GABA and just taking a day off or two.
Yeah, I hope that really resolves it because we don't want you to heal too soon, and we don't want you to have to go suffering through the nerve pain. But let's keep us posted for sure. All right, last question here from Armin. Can we increase a forearm for 2.8? The craziest thing, I think that somebody sent me an email saying that a surgeon somewhere, maybe in the US, is now considering doing forearm lengthening. I kind of got scared by that. I have to look into it a little bit more. It's one of the many emails that I get, but I was like, man, really? This is bizarre. Like, why are they doing this for cosmetic? Like, we know that surgeons have said that's super dangerous. It's not really recommended at all, but I'll look into it more. But no, you should not get forearm lengthening for cosmetic purposes. It's very risky. You can do your humerus if you really want to, but I bet you probably don't even need to. If I saw your pictures and proportions, I think there's literally like 5% of the population that would ever need forearm lengthening or arm lengthening after leg lengthening. So it's my opinion, but who knows? Alrighty. Do you guys have anything else you guys want to say or leave with the patients or listeners or vice versa before we wrap up?
Listen to your body. I mean, if you start feeling it's okay to take a day or two off. I wish I would have done that sooner.
Yeah.
So
yeah.
I can. Oh, sorry. Go ahead.
No. I was just agreeing with him. Yep.
Oh no, I can say something like about the result of the dysphoria. Like I can literally like feel it like disappear. Like I was just like when I went to the building because I'm walking always in the front of the building, so I meet a lot of neighbors. And this neighbor that I when I first started, like this really tall and buff guy, okay? And I was very intimidated by him, and I was like, I don't want to talk to him because I was like very, I don't know, it's just like this weird feeling you have, right? And then now I'm like, 6.5, like I started talking to him, and I don't feel like this angst or anger or weirdness towards this dude just because he's a taller guy and he's really buff, but I can talk to him and I'm like literally looking him in the eye and I'm just this same height as him, and I thought he was like super tall before. Now I can like talk to this dude and just be friends with him. Before I would just like just not talk to him because I had this anger or like, oh, this guy has everything going for him because he's tall, like this weird fucked up feeling, which is obviously not just feeling, but you don't have that anymore just because you did the surgery. So it's like you literally like calm the fuck down kind of deal, and you can like treat people nicer. And I think it's like a powerful thing that just happens as a result of this. It's like the dysphoria just really fixes itself, So that's just something I wanted to share.
Yeah,
I mean, he's still really super buff as fuck, but he could beat me up at any time. But I can like just look at him now, and I'm not intimidated by him. I don't feel like he has everything going for him. Like I can just treat him like a regular human being kind of deal, right?
Yeah, not out of spite or anything. Yeah, no, it's so funny you say that because I had a call with a patient yesterday, and he had hit 6.3 on his femurs, and now he's walking. He did his final checkup with his doctor, and he said that he was at the pool the other day or something like that. He had a shirt off, and he saw from afar a guy that looked like he was way taller than him, and this guy is now just about 5'11" 3/4", barefoot, but with shoes he's like over 6'1" or whatever. So he goes up, he starts walking a little closer to the guy, not to talk to him or anything, just kind of like passed by, and he sees the guy, and he says that as he got closer to him, the height kind of normalized, and he kind of like leveled off in his eyes, and he's like, oh, he didn't seem as tall the closer I got. And he said that I feel so much more like relieved, kind of like what you said, MD. It's like relieved and not apprehensive or like tense around other people who I felt like I was sizing myself up against.
Yeah.
And I think that's the power of the surgery. It's not only internally where it kind of flips the switch and it kind of turns off the gnawing thoughts that kind of bother you about your height, but it also socially in your environment, it kind of reduces your anxiety, right? And I think that's so powerful. It's both a mutual subconscious effect between you and other people in your environment.
For me, it would just be turning into like anger and hate. I would like literally try to like destroy like it's always like this hate and anger and like towards people. Now that's gone. It's a much more. The world is a much more peaceful place, honestly. So
I love it. You're gonna take like your crutches and like whack somebody in the knee or something. I love it. Awesome. Socrates, the wise one. Do you want to leave anything with listeners?
I think that this process requires a lot of focus, and it's not over till it's over, right? So when you're done lengthening, you still got to do consolidation. When you're done consolidation, you got to prepare for when the rods are removed, because your walking is still going to be awkward. When you're done, when you remove your rods, you have still got to put in the effort to get back in original shape. And it's been a year and a half for me, and I know I still got a lot of work to do. Now I'm trying to get back to a marathon shape, but like your average Joe sees me and they're like, oh, this guy is just a guy, right? Okay. But I know where I was and where I'm at now, and it's starting to get harder and harder to be comfortable with myself slacking, right? So it's like now I feel like I got to make up for lost time, because like I said, this marathon's not going to run itself, and I'm going to hate myself if I don't hit that target. So aim high. And there's a Henry Thoreau quote where he says, people hit what they aim at. So aim high so that you can be proud of your results, right? And that's what I'm shooting, and that's my advice to anybody who has the gumption to go through this very difficult process.
I love that. That's amazing. I love that little. I'm gonna have to screen clip that and use it in some video or something. That's really cool. Awesome. All right. Let's see. DJ Cyborg, anything for the listeners before we wrap up?
Yeah, I see a few more questions came in. I think we might want to go.
Oh, you're right. Wow, where'd they come? Yeah, these people are pop. Okay. All right. MF, we're gonna answer these rapid fire. I'm gonna throw one at DJ. We're gonna go around the panel real quick. So MF, this one's for you, DJ Cyborg. What's the recovery time and weight bearing after nail removal? So did you get your nails removed?
I think Socrates
will answer. Yeah, go ahead, Socrates. You answer this one real quick.
So you're not, like I said, you're not allowed to run after removing the rod for 6 weeks, but it's just 6 weeks on the calendar, right? Your bones are not gonna be the holdup is your biomechanics and you getting used to it. So from the day you remove the rods, it might take a day or two to kind of get back into normal walking and all that. You got to keep up the stretching, keep up the lifting, so that you can get the muscles and the fascia back to normal and used to everything. And then sky's the limit. Just like listen to your surgeon. I mean, they know what the hell they're talking about.
That's excellent. Very good. This one from Ben Mendoza. Okay, we got to answer this one. How many centimeters can you get from the humerus in each arm? So what I've heard, most surgeons have said around 5 centimeters, just because of the base on the bone length. Talk to the surgeon, consult with them. I'm not really sure because I don't hear a lot of humerus lengthening, but I have heard that the average is around 3 to 5 centimeters, which is about 1.5 to 2 inches, give or take. All right, Vita, I go to Paley for my consultation next month. Nice. Want to schedule a procedure in late October this year. Cool. Well, the PMAX won't be back out if you're waiting for that, but you can definitely get the surgery. A lot of people aren't waiting for it anymore. So best of luck to you, and feel free to hop on the stream when you do. All righty. Cool. I think it was that all of them, DJ Cyborg. Did you see any other ones?
Yeah, I think that's it. Yeah.
Okay, cool. Awesome. Aiden, you're joining like literally as we're about to wrap up. That's always how it goes.
Hello, guys.
Man, yeah, awesome. How are you, real quick, man? We're gonna.
Hey, Victor, how you doing? How you doing? How's everybody in the panel?
Good. We got your lengthening twin on here, Aaron. He dropped some major golden nuggets earlier for everybody to listen to.
Oh, that's cool.
Yeah, I told Aiden about my situation, so he knows. I'm deep in the trenches right now, just trying to get out.
Yeah, Aiden, do you have any nerve pain like him?
No nerve pain.
Wow. See,
No nerve pain
that just goes to show you guys, like, these guys have surgery on the same day, and they're what length are you at, Aiden? Same 4.7.
I'm 49 right now. 49, 4.9.
He's past me.
Oh, he passed you because of the nerve pain. See, so that just goes to show that these guys had surgery same day, both in great health, great shape, and one has nerve pain, one doesn't. right?
And there's another surgery twin that's like she just passed 4 centimeters. So yeah, I mean, there's a lot of variability between all 3 of us.
Does she have nerve pain?
She did. Yeah, she had really bad nerve pain around like 2 centimeters ish.
See, this is what the surgeons should really be doing. They should really be doing data collection, because obviously not everybody comes to me and says, hey, so I figure out nerve pain. But they should be saying, out of 100 femur patients, how many got nerve pain, what was the severity and all that, so we can kind of get more information, right? Because I think that's something that we want to hear about, because just in the last 18 months, 24 months or so, I started hearing more and more nerve pain issues. But last summer is when I really started to hear it, as the PMAX was kind of here. And then Natalie made it really prevalent. And then now we hear Aaron, it's starting to kind of be a more common thing with femur patients. And maybe they were suffering in silence before, but hey, I think that's something that every patient should know about, is nerve pain. So very, very cool. All right. Yes, we're going to wrap up, guys. This has been a great show. Football clips. You do 2.5 on the tibias and 5 on the femurs. Okay. All right. There you go. It's pretty conservative on the tibias, but you can definitely do it. I don't know. I feel like if you're going to go through this is just my personal opinion. I feel like, but that's 7.5 total. If you were doing it for biomechanics and proportions, more power to you. But I don't know. I feel like if I'm going to break my legs, I have to try to get as much as you can safely. All right, guys. Yeah. So that's it for episode 165 of Limb Lengthening Live. This is Victor from Cyborg for Life and all these amazing limb lengthening patients signing out. Thank you guys for in the chat for asking amazing questions. We'll see you guys next time. Peace.
Take care.